and I really appreciate you organizing this. I have a very short story to tell you. Thank you, Anna, for your kind words. 1996, I was serving in the legislature. There was a new governor, Mike Foster. And I was appointed to serve as vice chairman of that Health and Welfare Committee. A pretty good position. Appointed to DHH was a young, intelligent man who sat before all those that were going to serve before that committee, or on that committee, and he made this statement. The charity hospital system is the best program for the poor in the nation. You know who made that statement? Bobby Jindal. Irony of ironies. Oh, how times have changed. When I listened to that, of course the first year was all fine and dandy, as is the usual case with his history. He would contact us, let us know what was going on. The next year we hardly ever saw him, and then he left after a couple of years. And you know, since that time, the longest job he's held has been governor. This is his 6th year. And it's been said before, when he first took office, he decided that he'd get rid of the last vestiges of the Stelly plan by cutting the taxes for the wealthiest of the wealthiest in the state of Louisiana, which cost the state the first year about $350 million, and about $400 the next. This year would be about $500 million. Over $1 billion, close to $2.5 billion, and you wonder why we have no funds to operate the state. We have a governor, as Mr. Stagg stated, that is refusing to participate in a Medicaid plan to expand it for the poor, and yet not accepting the money that would be free for the first 3 years. And when I say that, I know that federal taxes come from the states, but guess what? Us refusing to accept it doesn't mean the federal government's going to have a little bit more money. They're going to give it to other states that have accepted, including 9 states as of now, with Republican governors who have said, this is best for our people, regardless of your political beliefs. So it's not a Republican, Democratic issue. It is for the people to determine this. And now we have a plan to eliminate income taxes. And look, my goodness, that would benefit me. No income taxes? Oh my goodness. But is it fair to make the poorest of the poor pay a higher rate of their income than those who are better able to afford it? Now, as I step down from here, I want to mention something to you. When you have a plan, you can debate the plan. But when you have no plan, there is nothing to debate. On this table, and before you leave, I want you to give me one of those. On this table, to my right, your left, is a petition. You started signing it, and of course we didn't have time to pass it around. It's hard to write in the air. Sign your name proudly, legibly. Print your name so they can read it. Print your address so we can petition that they keep charity hospitals open. On this table, we have the governor's plan for what's going to take place of the charity hospital system, the 6 around the state that he wants to close. Y'all look closely, because the plan is right here. Look closely. Do you see it? Do you see it? Because there is no plan. Do you understand me? As of today, he has not presented a plan for his private-public partnership to take the place of Charity Hospital. He has one in East Baton Rouge, but the other 5 have no plans. If you have no plan, you have no vision. If you have no vision, your people will perish.